to the COVID community conversation for February 4th, 2021. My name is Brian Wheeler from Mono County Public Health, and I'll be your host tonight. I am again joined by many panelists from county government and also from the town of Mammoth Lakes and a few other individuals as well. I know there are probably going to be a lot of questions tonight, so why don't we go ahead and get into the presentation that Stu gives us at the top of every show. Stu?
Thank you, Brian. Welcome, panelists. Welcome, community, to the Mono County COVID-19 community conversation for February 4th, 2021. And I believe today the state published a press release with our 1-year anniversary of our first case in California. So there we go. Here we are. But we move on. Again, just want to welcome our Spanish speakers. If you'd like to listen to this conversation in Spanish, follow these steps highlighted in yellow. Want to make sure when you're logging in, you look for the interpretation icon. Click on that for Spanish. You can also watch the meeting live now on the Mono County Health Department Facebook event page. We include this slide each community conversation just to make sure everybody has this saved on their computer and their bookmarks. This is the Mountain View Fire Incident Portal, and you can also get information on the Mountain View Fire Resources and Recovery Facebook page. And the team tells me that the website is updated, and I had a quick look with some quick links. Makes it easy to get to the information you're looking for right there at the top of the page, and also a dashboard. Very helpful information. So again, credit to the IT team for putting that website together. Tremendous amount of resources and information available to those affected by the Mountain View fire. So let's get into the conversation. Again, just want to encourage everybody to stay safe, to stay open by distance, wash, cover. Again, face masks work. We want to make sure you can get vaccinated when it's your turn. And we want to encourage you to stay informed, be civil, and respect each other. As we said, we're a year in. The light is at the end of the tunnel, and we're doing great here in Mono County. So again, continue to distance, wash, and cover, wear your face masks, and pre-register for the vaccine. We'll just have a couple of slides here on our case metrics. Again, you can find all this information and more on the case stats portal. You can kind of see there at the top right-hand corner of your screen. This was as of this afternoon, 917 cases throughout Mono County, 713 in Mammoth Lakes, 107 you can see there in North and Central. And you can see we have less than 92, 93 cases over there on the south side. This is probably one of the most popular graphs we look at, and you can see here finally that we're starting to see a flattening of the curve, which is great. So you can see our total cases, as we said, 917, only a 36% increase over 30 days, or 245. So definitely going in the right direction. These are some slides that are provided by Public Health each week. Thanks to Emily and the Public Health team for putting this together. So these are hot off the press today. Again, you can see here our positivity rate from our PCR test came back at just a hair over 6%. You can see that's down from just over 9, just over 12, and you can see 18% there at the beginning of the month. So again, definitely moving in the right direction. So good work, everybody, for keeping your distance, washing, covering. And again, just a little note here at the bottom right-hand corner of the screen. Just want to make sure that everybody can see that this testing data is compiled by our team, and the numbers may not align perfectly with what the state is posting on their website. So let's just check where we are on the blueprint for a safer economy. Speaking of the state metrics, this is what's used by the state to classify our tier status on the blueprint for a safer economy. For the week of January 17th to the 23rd, so you can see there it's a 7-day lag. Case rate was 29.7 per 100,000. which is tremendous. I mean, that is down in 2 weeks from 80. So definitely moving in the right direction. And our positivity rate is certainly moving in the right direction too, just a hair over 9%. So you can see we are still not in the red tier. We're not in red tier metrics at this time. And you can see here just a couple of bullets I've added. We are required to stay in our current tier, which is our purple tier, for a minimum of 3 weeks. And to move to the red tier, we have to meet those less restrictive metrics for a consecutive 2-week period before we can progress to the less restrictive metrics. So right now we are not at red tier status, but definitely moving in the right direction. And then we have to remain or meet those metrics for 2 consecutive weeks before we could move to the red tier status. If that's not confusing enough, visit that website right there at the bottom and you can confuse yourself even more. Just going to move into some of the guidelines that have come out from the town and the county. Again, these were the town lodging guidelines that went into effect on February 1st. You can see here, these will stay in effect through April 30th, 2021, or modified, repealed, or extended by the town during that period of time. Short-term lodging facilities, you can see there in parentheses that what that applies to, shall be managed to a maximum of 70% daily occupancy for a 30-day period or less. It must follow all state guidelines as follows or as amended. You can see here fitness facilities, when it talks about those, must operate outdoors. They must remain closed indoors. Outdoor hot tubs, however, can open for use by household groups. So if you're same household unit, or where 6 feet of distancing can be maintained. If a property or a HOA cannot manage those guidelines, then we recommend they stay closed. And again, indoor pools, hot tubs, saunas, and steam rooms must remain closed. On the county side, the county is following the Blueprint for a Safer Economy purple tier guidance. They are not, unincorporated Mono County lodging facilities are not subject to the Town of Mammoth Lake's lodging order. And you can see here in these bullets includes modifications and guidance related to the following. You can see that list. And again, as I just mentioned, in the purple tier, all of these amenities are the same as the town. And you can see fitness centers only outdoors, hot tubs, use same groups, and so forth. Right there at the bottom, though, you can see that last bullet references meeting rooms. They are required to remain unoccupied or closed during the purple tier. So again, meeting venues, banquet rooms must remain closed during the purple tier. School guidance, we include this slide on each and every one of our community conversations. And again, just really high level, grades 7 through 12 can only open in the red tier. However, grades K through 6 can open in the purple tier if the case rate falls below 25 cases per 100,000 for 5 consecutive days. And you can see there in parentheses, currently Mono County is tracking at 29.7. So again, very close, but again, we are not meeting the criteria from the state. And again, all this information and more can be found on the Blueprint for a Safer Economy website. Just type in Mono County, select the activity, and you can get your list. It'll just populate either by activity, or if you just type in Mono, it'll give you each and every tier status for each of those business sectors. So let's just jump into the vaccine update. So you can see here, we have our dashboard on our Vaccinate Mono website. It's updated every Monday, Wednesday, and Friday. So again, if you want to get the latest information regarding how many we've received, how many doses, first doses, second doses, visit that website every Monday, Wednesday, and Friday. Again, just with ensuring that we are administering vaccines according to state guidelines, proof of eligibility is now required at the vaccination clinic. Proof of residence or employment could include, but not limited to, your driver's license, the new Real ID, employment pay stub, a note from an employer, employee ID. We know many employers are providing a list to public health. So when their employees come in, we can just check them off the list. And really any document that verifies you as a Mono County full-time resident, we are not administering vaccines to second homeowners. Where are we now? Again, this information is on that website there right at the bottom. We are in phase 1B tier 1. As you can see, that's individuals 65 years and older, and those at risk of exposure at work in the following sectors: education and childcare. The childcare category means you must be a licensed childcare provider. Emergency services, food and agriculture, and that is our restaurant workers, grocery store workers, agricultural workers, and so forth. So to pre-register, sorry, I got ahead of myself there. Today, we also issued a press release for those residents aged 55 years or older. And if you have certain underlying medical conditions, which is listed below in these bullets, including pregnant women of any age, you are now eligible to pre-register for the vaccine, and you'll be scheduled to receive your vaccine. So some of the higher risk underlying medical conditions include, and you can see here the list provided by the CDC. So here we go. So if you are in phase 1B tier 1, or if you're 55 years and older with certain underlying medical conditions, or you or any women that are pregnant of any age, we encourage you to please complete the vaccine questionnaire. So again, you can see the website link right there at the bottom. It shouldn't take you too long, and this form is also available in Spanish. So these are just some highlighted recommendations that we would like to kind of inform you of. So if you are eligible to receive the vaccine, we want to make sure everybody knows it's safe and effective in preventing illness. You can see there it's highly effective, 94% plus. And then I know our panel tonight will talk about the Johnson & Johnson vaccine as well. It's now in front of the FDA for emergency use authorization. But also getting vaccinated offers protection from getting sick. Also offers the quickest way for life to return to normal. And you can see here over 3.4 million Californians, and you can see just under 3,500 county residents have already been safely vaccinated by Brian and the team. And vaccination is needed to get not only Mono County, but the state and our US economy back on track. So we're just going to run through some of the top questions that we've been receiving through public health, through our email, through our phone, from our 211 line. And we just want to dispel any rumors or misinformation regarding the COVID-19 vaccine. So I would ask if any of our panelists want to jump in as well on each of these slides, please do so. I'll walk through each of these questions. You can kind of read the response. And again, if any panelists want to jump in, please do so. One of the real questions we get is, will the COVID-19 vaccine give me COVID? That is no. The vaccines do not contain coronavirus and cannot give you COVID-19. And then the other question we get is, can I still get COVID-19 after getting the vaccine? And you can see here a couple of bullets that Pfizer and Moderna vaccines are about 95% effective, and that was measured a short time after getting the second dose. But a small number of people who receive the vaccination can be expected to still get COVID-19. And again, it is unknown how long the high level of protection will last.
So if I could quick jump in on that. Yes, you could potentially be able to get the disease. However, from what the evidence, from what the research is showing, the data is that almost no hospitalizations or serious illness happen in those individuals.
Thank you, Brian. Let's roll along. I think this was the next slide. Yep. So again, we get this question, what side effects, how many people, experience side effects after the vaccine. You can see here many of the bullets. So, what we're really seeing is definitely, a sore arm, maybe last 1 or 2 days. Other normal side effects may include headache and fatigue, and are usually rated by the patients as kind of mild to moderate in severity, typically last a day or two. A smaller number of people may have other, say, flu-like symptoms, including fever or body aches. In most cases, such normal reactive symptoms last 1 to 2 days. And you can also, or may also experience redness at the injection site. And I don't know if any of our panelists want to jump in between the difference of the first dose and the second dose. I heard there's some different kind of symptoms.
Sure. I mean, I can share
Yeah.
my experience. The first dose I received, I just had that sore arm for about 2 days. And then it dissipated and everything was back to normal. My second dose, I did have the sore arm, not as sore as the first time, but I did have some flu-like symptoms, just some, fatigue, no fever, but fatigue and just feeling off, a little nausea for about 36 hours. And then it cleared up and I was back to normal.
And I believe that's just relative to the body's immune response. Is that right, Brian? It's just doing its thing.
It's
That's
the immune
perfectly
system doing its thing. You got it, Stu.
normal. All right. Let's roll along. Is a fully vaccinated person capable of being infectious? Don't really know yet. Good question. Most, but not all vaccines that are in use for other infectious disease do prevent infectiousness. And is the vaccine effective for life? Again, we don't know. Coronavirus has only been circulating in humans for, well, about a year. It's anniversary today in California. And the vaccines have only been in existence for a few months. We'll certainly learn the answers to such questions over time. Jump into the next one. I've already had COVID. Should I get vaccinated? Yes. But again, the chance of getting COVID again in the months after infection is extremely low. So it's reasonable to wait a few months before getting vaccinated. It is safe to get the vaccine anytime after you're recovered, but with vaccines in short supply, if your risk is very low, it makes sense to let someone else at higher risk get that vaccine now. And the other question we do receive is, are there any impacts to fertility? And at this time, there are no known fertility concerns. If we want to get technical here, Dr. Boo indicated that such effects are highly unlikely with an mRNA vaccine because the mRNA does not enter the nucleus of our cells and will not affect our DNA. All right, rolling along. Perhaps, one of the biggest questions we're getting is, hey, I've got vaccinated. Now what? Can I stop wearing a mask? Do I need to, keep doing all my, personal hygiene habits that I've been experiencing? Well, the answer is not at this time. You can see there's still many unknown and unanswered questions. You can see here many of the bullets. You can kind of read along. We obviously still need to understand a number of things, whether getting vaccinated can still be silently infecting and spreading to others. We don't know how long the protection really lasts. We understand the vaccines are not 100% effective at this time. Might not work as well against one or more of the new mutant strains that are prevalent, certainly across the globe and certainly here in the US and spreading throughout California. And we know there's some mutant strains here in Mono County. And also relatively few people have been vaccinated in California. So it makes sense to continue to expect everyone to wear a mask. And I really think the most important one here is that you want to please keep in mind that there is a good chance that you would make others very much uncomfortable by going outside or interacting with people inside without a mask. So I'm going to pause there and see if there's any other panelists' thoughts or views on that topic, that question. Great. And the last one, this was released today from the state And it kind of covers testing. We get that question, look, I've got the vaccine, do I still need to get tested frequently? What is this all about? Here's some bullets, here's some answers to this question. Again, really want to make sure everyone's wearing face masks. As it says, it's possible, they're not likely to get COVID. And again, as Brian said before, being vaccinated, you may not get sick, you may not get hospitalized, but you still may be able to spread that to your family and friends. Again, just good practices here. Stay home if you're sick, get tested if you have symptoms. And tests for COVID work the same in vaccinated people as they do in unvaccinated people. Testing keeps you, your family and friends safe. Again, if your job requires it, get tested regularly, even if you've had the vaccine. And these ones here are obviously our best practices, our distance, wash, cover, wash your hands, practice physical distancing, and then gather outside if you can. Now that the snow stopped falling, I know everybody's eager to get outside and out from our indoor cocoons. So definitely encourage outdoor events, much safer than indoor events. And that also translates into this weekend's Super Bowl. So again, we want to really minimize those indoor gatherings. They can be seen as kind of this super spreader event. Really want to kind of limit your interaction with people from outside your household unit during the Super Bowl. So with that, just want to kind of run through some quick testing information here. I know we've spent a little bit of time on this already, but again, please jump on our website, pre-register if you can, every Monday and Thursday here in Mammoth Lakes at the Mammoth Lakes Foundation. Verily tests every Tuesday and Friday at Sierra Star and in North County on Fridays as well. Again, updated business resources. I want to encourage all our businesses to visit this page for the latest information. Again, if you're looking for housing assistance, contact the Mammoth Lakes Housing. Call 934-4740, still have funding available. And the town just completed 5 rounds of the Business Assistance Program, which resulted in a total program award of over $877,000. And we are listing all the round 5 recipients on this slide. We're almost there. Business assistance programs. Again, this was a slide from a couple of weeks ago. PPP round 2, California Small Business Relief Grant Program. I believe round 2 has started with that program as well. And then the Mono County Cures program has ended. $420,000 dispersed to 48 eligible businesses. Thank you for joining us this evening. It's February 4th. Our next community conversation will be February 21st at 5:30 p.m. And again, all this information and more can be found on all these resources, our websites, email, we have hotline numbers. And again, I would really encourage everybody to subscribe to receive our COVID-19 newsletter delivered every Tuesday and Friday to your email box on your computer. With that, Brian, I will pass it back to you and the panel.
All right, thank you, Stu. And I just wanted to give all of our attendees just a little heads up. If they should happen to log into our vaccine page on Monday, they will probably see a very different number. So I encourage you to, I don't want to give away secrets or be a spoiler, but I encourage you to check in and see where we are after we update on Monday on the vaccine numbers. Well, I would just want to say welcome to all the panelists. It's good to see you all, and I'm sure we have some questions already. But before we get started, does anyone care to make an opening statement? All right, then we will move right into Q&A.
Do you have any information regarding positive PCR testing with active vaccination interference?
I will ask Dr. Boo and Dr. Burrows to address that question if they can.
Can you repeat that again?
Yeah, I don't really understand the question.
Sure. Do you have any information regarding positive PCR testing with active vaccination interference?
I think they're asking if there are false positives secondary to vaccination for COVID.
Yeah, as Stu pointed out, and Dr. Boo, please correct me or add anything if you like, but the vaccine should have nothing to do with your ability to test for this. And this is part of the reason that we're encouraging people that even if you've been vaccinated and you're symptomatic, to please get tested, because it is conceptually still possible that you can become infected. The results of the studies that allowed these vaccines to be put out and allowing us to start vaccinating people are studies, and they're extremely encouraging, but real life situations and study situations are not necessarily exactly the same. And the only way we're going to be able to determine exactly how effective these vaccines are is if we test people when they're symptomatic. That was basically the way the study was designed in the first place, is people got vaccinated and there was a pool of people that didn't get vaccinated. And then when people became symptomatic, we did testing on them to determine, is this from COVID or from something else? And that's effectively or eventually how we arrived at the conclusion that these vaccines were as effective as they are.
Thank you, Dr. Burrows.
Thanks,
Go ahead,
Dr.
Dr.
Burrows.
Boo.
Yeah, no, it's a little bit nuanced. I mean, it's very clear and definitive that you can't get a positive PCR test, which is the main type of diagnostic test that's used from vaccination. On the other hand, we don't really use antibody tests for diagnosis, but a lot of the antibody tests will not be able to distinguish somebody who's been vaccinated from somebody who has had previous infection. There are antibody tests that can do that, but you could certainly get a positive antibody test from having been vaccinated. The antigen tests are interesting because, the mRNA that's injected with the Pfizer and the Moderna vaccines, basically it is directing the cells in our deltoid muscles to make antigen, the same antigen we would be testing for in the in the nose and the nasal passages. But so if you were able to somehow put a jam an antigen swab into your deltoid muscle, you might get a positive test there, but you won't get one from your nose. So.
Thank you, Dr. Boo. I'll try jamming that into my deltoid tomorrow and see what I can find. Thanks. Why don't we go ahead and go to our next question?
Is there any prioritization for our workers involved in snow removal?
I assume that's in regards to vaccination. We are following the state guidelines and tiers and phases for vaccination currently. We're actually a little bit ahead of where most counties in the state are thus far. And I believe, individuals who would be in snow removal would be under some of the infrastructure that would currently be under phase 1B tier 3, I believe. Is that right, Dr. Boo? I'm trying to remember.
Yeah,
exactly.
no, I think there was some guidance from the state, which we have shared, I believe. Those would be public works department, right? And so they're actually considered emergency services and eligible in the current tier. And I know some of them have been vaccinated. So.
Okay, well, thank you, Dr. Boo. I see, Dan, you have your mic off.
Yeah. Brian's let you know that I know at the town level, because of that public work status and public safety workers, emergency service workers, the majority of our snow-related staff have been vaccinated, at least the first round, and some of them, I believe, second, but they're in that process. And that includes our mechanics, our snow removal operators, our parks guys that clear our sidewalks in those areas. So, yeah, they were scheduled into that public safety, public service worker underneath that earlier tier. So I don't know if it applies to the private snow removal operators, as they're not public works departments, but we did take advantage of that and able to get a lot of our employees in based on the tiering system.
And the tiering system may be changed. Dr. Boo, have they made the announcement yet as far as the age?
No, I don't think so. I'm still a little bit confused about the people with the pre-existing conditions. I mean, we heard on the call early in the week that those people are now eligible for vaccination, depending on where a county is in their vaccination efforts. But I heard today on a call when I asked for clarification that those folks are considered part of the second tier of phase 1B. So even that's a little bit confusing, but we have opened it up to people of a certain age with pre-existing conditions who are under 65 years old.
Absolutely. We are trying our very hardest to reach our most vulnerable populations. Thank you, Dr. Boo, and thank you, Dan. Why don't we go to our next question?
Can I wait outside the clinic for extra doses? And is there a list for extra doses that I can get on?
So we do not encourage that. We do know that that phenomena is pretty much happening everywhere across the country. Vaccine chasers is one title they were given, but just individuals showing up hoping that they can get a dose, that there'll be extra doses. And sometimes we do have extra doses, but we still prioritize and we have a list of people we reach out to who would qualify under the phase and tier that we're currently in. So we do not encourage you to show up seeking an extra dose at this time. Why don't we take the next question?
If I'm unable to make my second appointment, how long can I wait between doses?
Dr. Boo.
Yeah, thanks. We encourage people, CDC, everyone encourages people to prioritize keeping that second dose appointment. That's what has been studied in the trials. But things happen, and CDC is currently saying that for both the Pfizer and the Moderna vaccines, it's okay to delay the second dose up to 6 weeks or 42 days after the first dose.
Thank you, Dr. Boo. Why don't we take our next question?
If people from different households have been vaccinated with both doses, is it safe for them to gather without wearing masks around each other?
Well, I think we actually, Stu, can you pop that up there? I think we kind of covered that in Stu's presentation. That would not really be advised. You still need to wear your masks and distance and hygiene, all of those things that were on this slide, yes. So yeah, we still have to maintain all the mitigations and protections we're currently doing. Because again, you could still potentially, even though you're vaccinated, could still potentially have COVID, even though you might feel absolutely fine. And you could pass that along to someone who may not have the best outcome from catching the virus. Thank you for putting that up, Stu. Why don't we go ahead to the next question?
If I lost my vaccination card after my first dose, is there a way to replace it?
Absolutely. When you show up for your second appointment, for your second dose, we will just issue you a new card with the information from both vaccinations on it. Next question.
Will the hospital be administering vaccinations in the future?
I will ask Dr. Burrows to address that.
So the immediate answer is no. As of right now, the hospital has pretty much exhausted its supply of vaccines, which were used to try to make sure that we had all of our frontline workers vaccinated. In discussion with members of public health and the rest of the county, I think we all collectively agreed it was a better use of our resources to create the clinics that we have going now, effectively vaccine clinics. Now, the long-term answer is probably going to be different, and I'm going to apologize because I don't know what long-term means, but at some point in the future, like 6 months, 8 months, a year from now, I think it's very likely that the hospital will administer vaccines like they do any other type of vaccine. But for the initial push to try to get as many people vaccinated as possible, no, the hospital is not going to be doing that.
And just to add on to that, the hospital has provided us with a fair amount of employees that they're paying to come help us at these clinics. So the hospital is involved. And probably Dr. Burrows, I would imagine that if J&J gets the Johnson & Johnson vaccine gets approval, and that's a simple refrigerated one-shot vaccine,
Yeah.
that might be a game changer for the hospital as far as
you
in
know what,
clinics.
I think everyone has to appreciate that all of this is subject to change. And
Sure.
we have been using that phrase forever with everything related to COVID. But as Brian said, yeah, the Johnson & Johnson vaccine has a lot of advantages. One of which is it doesn't have to be stored in what we refer to as a deep freezer. So a lot of facilities, the hospital included, have refrigerator systems that can hold on to that vaccine for a long time without it going bad. The other huge advantage is it's one shot as opposed to two shots. So, whatever we're saying right now, unfortunately, please, it's not written in stone or blood. A lot of things could change, hopefully for the better. But for now, anyway, with the Moderna and the Pfizer and our concentrated efforts to try to make sure we vaccinate people with what we know we have, it's going through the public health efforts in coordination with a lot of people in the county and the hospital to get people vaccinated through our vaccine clinics.
Absolutely. I did fail to mention that we're having assistance from CERT and from EMS and from volunteers that John Erdes pulled together that is typically used for handing out food. So yeah, it has been a team effort all around, and just kudos to everyone involved and my deepest thanks. Why don't we go ahead and go to our next question then?
Last time there was mention of a California mutation which could be passed in the cold. Little was known about it at the time. Is there an update on this?
Go ahead,
Yeah.
Dr. Boo.
Sure. Yeah, so I'm not sure about that. The part about that can be passed in the cold, but there is a strain that has gotten a fair amount of attention that first was identified in Wuhan, China, in the late spring of last year, but now seems to be quite common in California, and it has been associated with some outbreaks in Santa Clara County specifically, I believe, where quite a few people seem to have been infected. So there was concern that it might be highly transmissible. But, CDC and CDPH, the federal and state public health authorities are not currently too worried about it. They're classifying these new strains as variants of concern, which are the more worrisome ones, and so that's the UK strain, the South African strain, and the Brazilian strain, those three, and they're classifying this California strain, and the nomenclature, the terms that are being used keep changing. I think it was L452R, and now they're calling it B1427 and B1429 or something like that. But we don't really have any evidence that it's truly more transmissible, or any evidence that that it will evade our immune systems that have been primed by prior infection or by vaccination. And I would also just add, it's common enough now that with infection rates dropping pretty much throughout California and in Mono County, where a significant number of those variant specimens were identified, it doesn't seem to be adversely affecting the current trends.
But Dr. Booth, they do believe that the UK strain could be the dominant strain circulating in this country sometime, perhaps even by March.
Yeah, CDC has done some modeling where they projected that, and it has been identified in a number of counties in California. There's not enough genetic sequencing to know really very well just exactly how common it is, but yeah, that one we do worry that it could reverse the current progress that we're seeing. It remains to be seen, but it's again quite important to to keep doing the basic protective measures. Yeah.
Great. Thank you, Dr. Boo. Can we go to our next question?
I have allergies and get allergy shots. Should I get the COVID-19 vaccine?
Dr. Boo, Dr. Burrows, your thoughts?
Sure. No. Yeah. No, if the only absolute only absolute reason not to get the vaccine is if you've had an anaphylactic, a truly life-threatening immediate allergic reaction to some component of the vaccine. If you've only had typical allergies, albeit kind of bad, there's no reason to think you shouldn't get the vaccine. And we've given the vaccine to a lot of people who have had anaphylactic reactions, life-threatening reactions to other things, bee stings and other things. And we just ask those people to wait around longer. The standard guidance is 30 minutes so everyone is asked to wait around for 15 minutes. And there's guidance from the vaccine manufacturer and CDC that people who have a history of anaphylaxis should wait longer. And it's usually 30 minutes, but there hasn't been a single case that I read about a couple of weeks ago where the anaphylactic reaction to Moderna didn't occur until 30 to 45 minutes. So I have advised our staff that maybe 45 minutes is a slightly better time to have people wait, but that would be very rare. Usually anaphylactic reactions happen within 15 minutes.
And I believe the number I've heard is 2 to 6 anaphylactic reactions per million vaccines. So very low number.
It's an outrageously low percentage of people that have had even a severe reaction.
Right.
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 It's about twice as common as anaphylaxis with a flu vaccine, and I think it might be less common than when people take penicillin. So. Yeah.
Right. And we do have Chief McCrassick with us, and his paramedics that are underneath him are at all of our events and ready to jump in should we need any kind of severe or urgent medical care. Chris, would you like to add to that?
No, we take that role very seriously and are definitely standing by and have the medication available to counteract any anaphylactic reaction and then immediate transport to the hospital if needed. So we are providing that service at every event.
Thank you, Chris.
Just because these clinics are happening like at the Mammoth High School gym, that does not mean that it's not staffed with absolutely everything and everyone that needs to be there, like it would be for any clinic visit under any circumstance.
Thank you, Dr. Burrows. Thank you, Chris. Thank you, our Chief McCrassick, and thank you, Dr. Boo. Can we go on to our next question?
If I have been fully vaccinated and am exposed to someone with COVID-19, do I still need a quarantine?
Dr.
Yeah,
Boo?
I'll take that. I'll take that one. As of now, yes. This was actually raised on a call with the state today, and CDC has been so CDC often comes out with guidance that the states then follow on such matters, and the state expected CDC to come out with some guidance that might make it unnecessary to quarantine if you've been fully vaccinated some weeks ago, but there must be some ongoing debate or something at CDC because it's been delayed. It hasn't come out yet. So as of now, we would expect you to quarantine after exposure, but that might change soon.
All right. Thank you, Dr. Boo. Before we take our next question, I see we have Sheriff Braun and Chief Davis on. I was hoping they could give us an update from their end. Good evening, Sheriff.
Muted.
There you go.
Darn that mute button. Not much update for us to give. We have provided, and I know Chief Davis and his personnel have provided a security presence at some of the vaccine clinics for those who are concerned, but there have not been any issues. Everybody has done very well. Everybody's moved along nicely thanks to the organization of how these clinics have been run. Everything's been fantastic. So I don't have anything to add. with us moving into the purple tier from the stay-at-home order, that lifted a lot of the enforcement issues. So we don't have that concern as much anymore. People have really migrated into understanding the need for wearing a mask. And that's not, back in the summer, we had a lot of people calling in with mask concerns, and that's not a question that we really have anymore. It's become pretty universal. So I thank everybody for their cooperation and doing what they have to do to keep everybody safe. And I don't have anything else to add.
All right. Thank you, Sheriff Braun. Chief Davis?
Pretty much the same thing. My team has been at the clinics just hanging out and meeting and greeting, and no problems whatsoever. So, and no problems in town, just a lot of people enjoying the snow and crashing.
Yes, I'm sure it was a very busy fender bender days for you guys last week. Maybe
Yes,
even more than some fender benders. I do want to thank you both for providing support at our vaccine clinics. Greatly appreciated. Okay, why don't we go to our next question?
Does Mammoth Hospital think we should be locked down still?
Dr. Burrows?
Does Mammoth Hospital think we should be locked down? I think the step that we've been in with conjunction with the EOC and everyone involved with this has been we are trying to be right in line with what the state is telling us to do. So the state, and I don't know that the hospital or I or really anybody has any jurisdiction to say, no, that's not right. We feel like we should be locked down. I think the current regulations and orders that have been put forward are very reasonable and allow for really the keeping the spread from getting out of control, which our numbers, as Stu pointed out in the beginning of this, are very clearly going in the right direction. I think if we got to a point that things were out of control, we would have to rethink our position on where we are, but I think the state would also do the same thing. I think being locked down has a lot of disadvantages, not necessarily directly related to COVID, but obviously the health and well-being and sanity of everybody involved with this. And I don't say that lightly. I mean, there are issues economically and socially with every aspect of normal life that has been compromised for, as we've talked about, going on a year. So, this is like everything else. It's a risk-benefit consideration. And right now, anyway, the state is saying we can be open and people can visit and you can travel. And until numbers or caseloads bear out evidence to the contrary, I think we should continue with the path we're on, which is we've talked about. People are masking, people are seeming to following the rules. Numbers are at this point trending in the right direction. This is why we don't just close the book on it. We continue to assess it and look at it and determine, are we still in a good position to be doing what we're doing? And at least as of right now, February 4th, the answer is yes.
All right, thank you, Dr. Burrows. Why don't we take our next question?
Can I still donate blood and or plasma after getting vaccinated?
Dr. Boo, Dr. Burrows?
Yeah. I think it should be just like any other vaccine. No issues.
I would agree with that.
Great, thank you, doctors. Let's take our next one.
Are the doses interchangeable?
That's an interesting question. Go ahead, Dr. Boo.
Well, you could answer it just as easy as I can, Brian, but answer is not known. They're starting to study that in England in particular. But the official policy is do not interchange them because it has not been studied. But if somebody has to get Moderna after their first dose, Pfizer for some reason, or there's a mistake, confusion, and they get different ones, they're considered fully vaccinated and they don't need additional vaccination. But there'll be a lot more to learn about this.
In time. Thank you, Dr. Boo. Why don't we go ahead and take our next question?
If the vaccine is safe, why can't children get it?
Really, it's just because it hasn't been, sorry, Dr. Boo, I saw you turn your mic off, but
No,
there
go
hasn't
ahead, go
been,
ahead.
there hasn't been much in the way of studies with kids. I know they're working on that now, and probably sometime in the very near future, we could potentially have guidance on, different younger age groups lower than 16 being able to receive the vaccine, but we don't know what the timeline is on that yet. Anything you'd like to add, Dr. Boo?
Well, I did just hear Dr. Fauci on the radio about this. So yeah, both Moderna and Pfizer are doing studies in kids 12 and up right now, and Anthony Fauci speculated that by late spring or early summer they'll be approved in kids of that age. Yeah.
Good news. All right, let's take our next question.
If I had a mild reaction from the first vaccine, do I need to let anyone know when I go get my second?
A mild reaction such as the ones that we listed earlier, are completely expected. So no, that's not a concern. If you had some kind of severe or prolonged reaction, I would say sharing that information. But in general, I think you'd be okay. Doctors, anything to add to that, or?
No, I'm in agreement with that, Brian. I think, again, the mild reaction is somewhat to be expected. What we're really concerned about, or what anyone should be concerned about, is the severe reaction. Certainly if you had your first one and you're going to get your second one. But if your arm was sore, or you had some aches or some headache, that's, again, to be expected. I think more
Right.
people than not have something.
So yeah, thanks, Dr. Rose. Yeah, so let's just sort of, we're using the terms anaphylaxis and stuff like that, but maybe we should talk a little bit more about what that is. I mean, it's an immediate, immune mediated reaction, and the full on, classic symptoms, worst case scenario are people often experience swelling of their tongue and upper airway, develop wheezing and trouble breathing, break out in hives, urticaria, blotchy rash, and can go into shock. They can drop their blood pressure dramatically and severely, and the breathing and the blood pressure cardiovascular issues are the truly life-threatening thing. So it's not a subtle thing. People are very sick and very obvious. I've heard that in Inyo County they've had a few people develop wheezing after the some lung symptoms only, which I think they got epinephrine, but also were treated with albuterol, which is used for for treating people with asthma and COPD. And that would be concerning to me. It might not really meet the criteria for, an anaphylactic reaction, but I would think hard and talk long to someone if they had that reaction to the first dose. Also if you broke out in hives, I might be a little nervous about giving you the second dose.
Thank you, Dr. Boo. Go ahead, Dr.
Yeah.
Bowles.
So one, that's why Chief McCrassick's crew is there.
Absolutely.
And two, again, as we talked about, that type of reaction is, at least to date, extremely unlikely. It doesn't mean you shouldn't pay attention to it, but we really don't expect that we're going to see that severity of reaction.
Right. And again, that's also why we have that monitoring period after your shot.
Yep.
Where we're just keeping an eye on you to make sure none of these things happen. All right, let's take our next question.
If I get the first dose but not the second, am I protected at all?
Yes, you would definitely have some kind of partial protection. I don't know, Dr. Boo, do you know what the percentage of that would be?
Yeah, so, well, at the time of, so all I've really read so far, is with the original trials that people, at the time they got the second dose, before right before they got the second dose, they were felt to be 50 to 60% protected. Now, if somebody just got one dose and didn't get a second dose, would that percentage continue to increase over additional weeks? And I think the answer is probably yes, but the protection would very likely not last nearly as long as if you get that second dose. It wouldn't be as high and it wouldn't last as long, but there would be some substantial degree of protection. And again, there are people trying to study these things and understand them better, around the world.
Thank you, Dr. Boo. It is important to get that booster shot, so make sure you get both. All right, let's take our next question. Go ahead, Dr. Burrows.
It's called a booster shot for a reason. I mean, you're doing exactly what it sounds like. You're boosting your response at that point.
Right.
So it's not just a second shot. It's literally to greatly accelerate your ability to fight off the infection.
Thank you, doctors. All right, we have about 5 minutes left in our gathering this evening. Do we have another question?
Should we expect even more strains?
I would say yes. I mean, the nature of viruses is that they mutate. So I would expect there would potentially be more strains and probably already are, but I'd like to hear from the doctors.
Yeah, I'd say absolutely yes. I mean, there's uncountable, trillions of virus particles, replicating around the planet, and it's just inevitable that that mutations will occur. And it hasn't really been, so most of these things, these variants, they have more than one mutation, right? They typically have a number, and it hasn't really been determined or standardized exactly when something can be classified as a variant. But the most worrisome mutations are all the mutations of concern so far have to do with that spike protein that is both what the virus uses to attach to cells in our respiratory tract, but also is the thing that our immune system responds best to, whether after you're infected or whether you're vaccinated. So mutations that significantly change that spike protein to either make it even better at sticking onto it, attaching to our respiratory cells, or that change the shape of that spike protein enough that our immune system doesn't recognize it. Those are the things that are the most cause for concern right now. And so this UK strain that's spreading around the world, including in California, it's most notable for being more transmissible, because that spike protein can really latch on to our cells more efficiently. But they have recently reported, some researchers in England have recently reported that within that strain there is a new mutation which also may, not necessarily the ones that are here that have spread around the world so far, but so far only in England they've found some specimens from the UK strain that may also have what's called the ability to evade the immune system. So yeah, it's an ongoing thing. Surveillance, genome sequencing is super important, and this concept that we've got to immunize the entire planet. I mean, we can immunize the entire United States, over the coming however many months. But if people in Africa and South America and other countries don't have access to the vaccine, and the virus is transmitting freely there, mutations, variants can arise there that will then quite likely spread to the vaccinated countries and might set us back. So.
All right, thank you, Dr. Boo. I think we have time for one more question. It looks like we have one more question in the Q&A, so.
Will this eventually be like regular yearly flu shots where you need a shot every year?
It potentially could be, but doctors?
Yeah, possible. We don't know, but it certainly seems plausible, yeah.
Dr. Burrows, anything or any thoughts on that?
No, again, I mean, this is why you don't just come up with a vaccine and then close the book and hope that we're done. I have I guess every expectation that we could be looking at getting an annual shot, but to be determined based on how things progress and what kind of status we're in. I'm sad to say, a year from now, 2 years from now, whatever the time frame may be.
Thank you, Dr. Burrows. I'd like to thank all my panelists for being here and all the attendees at home for being here as well. We've run out of time for, I see the hand. Oh, you're just waving. I'm sorry. That was our CAO just waving to the crowd. But thank you all for being here. And there's Dan. Thank you, Dan. Thank you all for being here. And until we meet again, take care of yourselves and each other. Good night, Mono County.
Thanks, Brian. Take care, everyone.
Everybody.